This is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist at Vriksh Fertility, HSR Layout, Bengaluru. For individuals or couples with infertility who do not have their own egg or those who have attained early menopause, in these couples, donor egg IVF is a ray of hope. This advanced technology in the field of assisted reproductive technology is very important for couples who do not have their own egg or who are unable to conceive with their own egg. So who needs this donor egg IVF? If you're having any decreased ovarian reserve with advancing age, our eggs comes down, or sometimes in young women the egg reserve comes down faster. Number 2, if you're having any premature ovarian failure, that means for women who are in their 20s or 30s, they attain menopause earlier, their egg reserve is almost zero. Number 3, if you're suffering from any genetic disorders, so genetic disorders which you do not want to pass on to your future offspring, you can opt for donor egg IVF. Number 4 is repeated IVF failures. During your IVF cycle, once your eggs are retrieved, we come to know about the quality and quantity of the eggs. If you have poor quality of eggs and you're having repeated IVF failures with those, then you can opt for donor egg IVF as well. So the procedure of donor egg IVF involves a series of steps. Now with the ART rules and regulations being so strict and being implemented in our country, the donor IVF process has become streamlined all over the country. So firstly, the couple who are intending to go for donor IVF cycle, they are evaluated and their basic blood workup and health condition is checked. Then they are advised to collaborate with the ART banks, which is the Assisted Reproductive Technology banks, who together with the couple will apply for this donor egg IVF process to the magistrate and get permission from the magistrate. So a series of legal work is also necessary, which involves the coverage of insurance to the donor and legal documents and to prevent any kind of liabilities in the future. Once this work is done, a donor is selected by the ART bank who is screened thoroughly with regards to any medical health issues, and also the reproductive health of the donor is screened by doing an ultrasonography by a fertility specialist to check how her ovarian reserve is, and we also do a series of blood tests to assess the reproductive status of the donor. Once the entire selection process is done, we go ahead and we start with the ovarian stimulation for the donor. So a series of injections is given which usually last for about 8 to 10 days to the donor in order to stimulate multiple follicles so that we can retrieve multiple eggs. So once the follicles are ready, the donor is posted for a egg retrieval procedure which is done under anesthesia. So under anesthesia, these eggs are retrieved by ultrasound guidance transvaginally, and once these eggs are collected, they are fertilized by the male partner's sperm by the senior embryologist using certain instruments called micromanipulators in the embryology lab. Once this process is done, we let the embryos culture in the laboratory for about 3 to 5 days. Once the embryos are ready, the transfer to the female partner's uterus is planned. Either we can do a synchronized cycle, that means while the egg retrieval and the egg follicular growth monitoring is going on for the donor, at the same time we can start planning to improve and grow the uterus lining of the female partner by giving certain medications and tracking the growth of the uterus endometrium. Once this egg retrieval is done, after 5 days, if the uterus lining is also ready of the female partner, we transfer the embryo into the female uterus. Sometimes we do a frozen embryo transfer. That means once the donor embryos are ready and frozen, the female partner can choose to transfer these embryos whenever they want. So when the couple are ready to use these and plan their pregnancy, that particular month, the female partner comes on the second or third day of her periods. We start giving them certain medications for almost 10 to 12 days. Once her uterus lining is ready, the blood flow is good, then we start giving them progesterone injections and we post them for the embryo transfer, which need not be done under anesthesia. It's a very simple process.